Right, well, let's talk to my next guest, Stephen Dorrell, right now. He's a former Conservative Health Secretary, now a Liberal Democrat there, and a former chair of the NHS Confederation as well, which could basically brings together all of the NHS trusts. Good afternoon to you, Stephen.
Good afternoon, Julia.
Thank you so much for joining us. Just before we get on to the health stories, of which there are a number this morning, what are your thoughts? I mean, in terms of, you would have been in government when we saw, the Arab Spring, we saw those uprising across North Africa and the Middle East. And obviously there was so much hope then about how things would turn out, and pretty much didn't turn out well for anyone. I think Tunisia is the only country that hasn't gone to sort of rack and ruin as a result. What do you think this current government should be doing, if anything, about what's happened in Syria now?
It isn't going so well even in Tunisia. It's also worth remembering, isn't it, that back in 2011, actually Syria, the origins of the Syrian civil war were massive peaceful demonstrations in Syria itself. And so here we are 14 years later, huge disappointment across the Middle East following the Arab Spring. What should the British government do? It should sit and listen and watch very carefully. There are clearly a number of regional powers that have a big vested interest in what happens in Syria, notably Turkey, Iran. Israel, of course, has a very keen interest in what's going on in Syria. So I think the leaders of that process clearly have to be the people on the ground, not people in Europe or in the United States.
Yes, indeed. We shall see what is the fallout, but I have a horrible feeling it's not going to be something that we're going to welcome. But there we are. Stephen Dorrell,
if I may, can I just say I wholeheartedly agree with that. Nobody should mourn the passing of Assad. No. But I can't see anyone on the horizon at the moment that I would want to endorse.
No, certainly not jihadi fighters, but there we are. We're old-fashioned like that, eh? Let's turn back to what's going on in this country. And there's two interesting stories in the last couple of days in terms of the healthcare service. One is the West Midlands Ambulance Service. It's covering Birmingham, and this is a huge ambulance service. Basically, saying last week they've been under severe pressure. They confirmed that there's actually been a change to the script. This isn't the odd ad hoc 999 caller, but they get given scripts their call handlers should use. And they are basically now advising people who dial 999 because they're having a heart attack or a stroke, basically make your own way to hospital at peak times, because they are basically saying some of these waits are so long, patients are dying. Now, my own mother, December 2019, had a heart attack. As a former GP, realised she was having a heart attack, was on a bus already, got off the bus to get into a taxi, arrived at the hospital having the heart attack. Just sort of, thank God she didn't wait for an ambulance, because she probably wouldn't be here today. But it's an extraordinary thing if the people answering the phones for an ambulance are saying, we can't give you an ambulance, even when we know an ambulance would be necessary to save your life for a heart attack victim. What on earth has gone so horribly wrong?
Well, there's no defence for that. Clearly, the emergency services are there, should be there, with giving the highest priority to people with the most urgent need. Yeah. And it's very hard to think of a group of patients with a more urgent need than those suffering a heart attack or a stroke. Yeah. There's libraries full of clinical evidence that stresses the importance of prompt care for people in those conditions, and that underlines the need, of course, for prompt ambulance services. But if I may, I think it's part of a wider problem that we've seen on health service stories over the last week, because we've seen this story on the West Midlands Ambulance Service. We've had West Streeting, who I'm generally favourably inclined towards, but still waiting for a policy. West Streeting yesterday saying the key thing is to build GP services. I don't disagree with that. But the problem is, if urgent care is a priority and GPs are a priority, and last week we had the Prime Minister saying that waiting lists were a priority.
Yes. They're all a priority. It's almost like keeping people alive as a priority.
Well, and on a different day, don't forget, Julia, you and I would say that none of this will work until we get social care sorted out. So there's another priority. Yeah. And it's an old saying, when everything is a priority, truth is nothing is a priority.
Yes, and yet, of course, as you say, you can't deal with hospital care unless you've got social care sorted out because you've got all these people who are going into hospital unnecessarily and can't leave hospital. This awful phrase, bed blockers. But you're not going to do that without dealing with social care. But that also requires better GP care and easier access to GPs. And again, if you don't deal with the GPs, then more people go to hospital. And it's this big circular thing. Does it involve, we're constantly being told, just more and more money?
Well, it does involve money. There's no point denying that. But the truth is...
But there is more money all the time.
Well, of course, the government is making virtue of the fact that there is more money. And as I said to several people over the weekend, when we've got all these priorities and everything is a priority, thank God there's no constraint on resources. That's not the world we live in.
Yeah.
We have to make choices. We have to deal with we have to have a plan that shows how these interrelated services can be made more reliable for the benefit of the people who rely on them. And if you start by dealing with ambulance services and providing resources to enable people to live lives outside hospital, what you do is relieve the load on the hospital, you improve the quality of urgent care, and you enable the hospital to do more of the waiting list, treat more people on waiting list. But you do have to do it according to a priority. You have to decide which one you're going to do first without forgetting the others in order to ensure that you're tackling the issue in a properly planned way.
Well, I mean, you like me, you said you got a very good opinion of Wes Streeting. I do. I think he's sharp. I think he understands it. He was the first to say, look, the NHS needs reform from the Labour side, from a senior position. That's all bodes well. But as you say, he wants to rewrite the NHS workforce plan to, he says, create a transformed health service. Well, yeah, good luck with that. I think the thing we were all most stunned by was that under the Tories many years, there wasn't a workforce plan. Why senior figures in the NHS didn't think they'd do one anyway, because that might be a good idea. I mean, there are people who run corner shops who've got more workforce planning, frankly, than the entire NHS. I mean, number one thing we need to do is get rid of the chief executive, in my view. She's clearly and utterly out of her depth. But if you get more doctors to train to be GPs, you'll have fewer training to be consultants, won't you?
Well, if the question, of course, numerically, if you have the same number of doctors, then of course that's true. It doesn't have to be true that if you're training more GPs, you train fewer consultants. There's no necessary relationship between those two. And also, the health service has always had an exchange of other health systems in the world, and in truth has benefited from that. So I don't think we should close our minds to people coming into the health service to work from overseas, and indeed going from the health service to work overseas.
You say that. I mean, I've no objection to someone coming from abroad to do a job here, but I find it extraordinary. We sit there and go, we haven't got enough nurses and doctors, isn't this terrible? When there are thousands of young people with the grades who want to go to university, and we limit the number of places for a British person who's got grade A's coming out of their body, or coming out of wherever they come out of, coming out of their ears, and they've got the grade A's, but they're not allowed to study because they're only paying £9,500 a year. But someone from Singapore, Nigeria, India, or China, or wherever, they can come and study medicine. Because they're paying 30, 40 grand a year. I mean, and then we say we haven't got enough doctors. Well, of course not. Well, I mean, it's insane.
I'm sitting talking to you, Julia, from the city of Worcester, where there is a medical school which until very recently the university here was allowed to establish a medical school on presumably more than one condition, but one of the conditions was that it didn't accept any UK students.
What?
That lunacy.
I'm sorry, what?
Yeah, well, precisely. That was the position when they started the medical school here. No longer is the position, thank goodness, but it illustrates the kind of double think that goes on in official circles.
Yeah. And again, it's this idea that all these other countries have miraculously got to these incredibly clever people who can get these grades. I understand there are something like, in the early thousands of young people who would like to study medicine. I've got my daughter and all her friends are all going through those university interviews and applications at the moment, and it's heartbreaking seeing kids who worked so hard, who've got prediction, they've got not grade 9 GCSEs, they're being predicted A's and A stars in science and maths, and being told no, you can't have a place at medical school. But we'll just bring anyone in from another country and then claim we haven't got enough people here to do the job. I mean, it's heartbreaking.
If I may, Julia, I do agree with you about the nonsense of setting up medical schools and not allowing British students access to them or limiting the access. I agree with that. But I don't think I don't think there's anything inconsistent with agreeing with what you're saying about that. And at the same time, saying the health service should be open to people coming from overseas, and that we should continue to take part, as we always have throughout the history of the health service, in the international movement of people with clinical skills. I think the health service benefits from those exchanges.
Well, you say that, but I've mentioned this on air before. I remember when my husband was in hospital and we had to get advice on what to do with bandages and things afterwards, and we couldn't understand a word that the nurse was saying. I mean, literally couldn't understand a word. And we were very polite, and we kept asking again, could you write it down? Could you? And there was another nurse, and they're both from different countries. I don't think they could understand each other. No, I don't. I'm sorry, I don't think that is a good thing. There is also a massive issue in India. 1/4 of people in this was a report, I think, in Reuters did this. 1/4 of people who've got a medical, who work as doctors in India don't actually have a medical degree. You can literally purchase a medical degree. You can literally send someone else to do the exams for you in India. And yet, let's just import a load of people who may or may not have a medical degree while not training our own people.
So when I chaired the Health Committee of the House of Commons, which you referred to in your introduction, thank you, is one of the things we did follow up, that people shouldn't be delivering medicine or clinical services in this country without command of English, for the very obvious reason they can't communicate, as you say, either with each other or with their patients.
Well, so this was only a few years ago. We definitely couldn't understand what he had to say.
And people are not allowed to practice in this country as doctors unless they're registered by the General Medical Council. And the GMC maintains the standards of people who practice as doctors within the UK. Neither of those two principles cut across the benefit that the NHS has always derived from having people working within it that have worked in different medical systems. It's a great mistake to imagine that the strength in being closed. We should be open. We should understand how other people do things, because we might occasionally learn from.
Yeah, I'm just not entirely convinced that we're going to learn that much about how to run a medical system from third world countries. I'm sorry, I'm not. Also, here's another thing. The GMC, 75% of doctors who get struck off have been trained abroad.
Yeah, people who are struck off clearly shouldn't be practicing, goes without saying.
But they make they're a tiny percentage of the actual numbers of doctors who are practicing, but they're 75% of those who get struck off. I just don't think the stats bear this out. I just think, here's another thing. We've been talking about housing as well on this show, and and NIMBYs and the like. When we train up British people who are already here, or even the children of immigrants who are already here, and they're able to go to medical school or nursing, getting a nursing qualification, they're able to work here. They already live here. We're not importing new people to do a job that we've got plenty of young people who want to do in this country and who already live here. So we're not needing to build all those extra homes for those people. I mean, it's a win-win.
We've already agreed that if there are people who are qualified to get to medical school, they should have the opportunity to do it. That's not in dispute.
Yeah, but the government you worked in, and you'll know well, actually made even more limits. But again, by the way, also something that the British Medical Association endorsed. I'm
not here to defend every...
No, I know. Listen, I'll let you go. It's been a fascinating discussion. I really appreciate you joining us. Stephen Dorrell, thank you very much indeed. I wonder if you guys want to have a say on this. 0344 499 1000. Should we just be bringing in more foreign doctors? If you do have a priority on, focus on getting more doctors working as GPs, does that mean you have fewer working in hospitals and you end up with the same issue? What about having a heart attack and being told, don't bother calling 999, get someone to drive you to the hospital, get in a cab. I mean, that's what I would do, certainly. Claire Pearsall, ask people to call 0344 499 1000. That's right, 0344 499 1000. Text 87222. Get in touch on X at talkTV. Make sure I've got all the right numbers out there. Do get your calls in on that. But Claire, I mean, genuinely, other relatives, elderly relatives, they've had a fall, and the carer sitting there for 2 hours waiting for the ambulance. I'm like, oh my God, I'm down the road, call me.
Yes,
I think you can't wait for an ambulance anymore. But I'm thinking you can't wait for an ambulance for a fall because they're dealing with the heart attacks. No, In the West Midlands, they're not even dealing with the heart attacks.
And that's completely wrong. I had to go to hospital a couple of years ago with a broken pelvis.
Ow!
And my
husband... That is a serious injury.
It hurt a lot. And so my husband had to come and back the car into the stables and pick me up and get me out.
It was a horse-related injury.
Obviously.
She does this, people.
She
does this.
Horse-related industry. But he had to get me to hospital, so we had to drive in the car, park in a car park, which was not near to the A&E because there was nowhere to pull in. He then had to find a wheelchair.
I've got to be honest, I'd have just gone into the ambulance bay and taken the fine.
But you couldn't even get to it because there were ambulances queuing in it, so there wasn't any space because they were stuck there. So he then had to find a wheelchair to try and transport me in. It was not easy. I was quite grumpy, so I was sort of...
I'd be quite grumpy if I'd broken my pelvis.
But the most hysterical thing was him pushing me down a hill, which I didn't entirely trust him to get me to the bottom of it in well, I know I wasn't in one piece.
We can all laugh now.
In one piece. We can laugh now. The trauma has gone. But it's wrong. I'm lucky he could drive me. There are a lot of people that don't have that luxury.
No, exactly. It is just extraordinary. We're just not a serious first world country anymore.
Not anymore.
We're just not a serious country.